Hello, and welcome to the Dr. Toomer Talk Show. And I am Dr. Catherine Toomer. For those of you who are tuning in for the first time, I'm Dr. Catherine Toomer, family medicine and community health physician and weight health specialist, founder of Total Weight Care Institute. And I talk about all things health, wellness, and care related, where the art and science of medicine meet. And if you're tuning in for the first time, say hello. Even if you're tuning in after the 10th time, say hello. Let me know where you're tuning in from. And if you're watching later, just put in hashtag replay. It's always nice to know when someone's found this and decided to watch. And so, one of the things that I wanted to talk about, I'm just entering into full screen so I can see all your comments a little better. Um, so I want to talk about symptoms that people often dismiss as being nothing. Some of that dismissal is because we've gone to doctors and we've been, gaslit and told that they're nothing, and then they turn out to be something. Not all headaches are brain tumors, obviously, but some are. And so there's some symptoms that we often have that shouldn't be ignored. So I'm going to talk about the ones for women, and then I'm going to add the ones that are specific to men. And then there's some that are just crossover. Most of these can be, pertain to everyone except for a few, obviously. And you'll know which one those are when we get to them. So, um, and the reason why I'm talking about this is because I hear it so often. A lot of times people come to me for weight gain and they want to lose weight. Well, weight is a symptom of something. And so what this does is give me the opportunity to look for the cause of the weight gain. And often I find it, many times it's metabolic, but sometimes it isn't. And not all weight gain is good. Some is, like muscle weight gain is actually quite healthy. But any weight change gives me the opportunity to look for the underlying cause. And so, symptoms are very, very important to me. And but I hear about all of them, not just about weight, because I'm primary care, can't help myself. It's, occupational hazard. And so I do like to know everything that's going on because sometimes there are things that are hidden and it's good for me to know that and to bring them to light. And so the number one thing that I often hear is fatigue. I'm tired. Now, we are all tired. We all get tired. We all have reasons for being tired. However, what I'm talking about is tiredness that cannot be assigned to something else like lack of sleep or not eating enough food or exerting yourself more than usual. This is when you get really tired and you can't figure out why. Why are you tired? Why are there things that are making it so that you just feel like you're pushing through molasses? And the thing with that is, sometimes that fatigue can be physical and sometimes it can be psychological, but whatever the reason, it should be addressed. Because anything that is at a low level that is problematic will only become more and more problematic as it goes on and as it gets unaddressed. And so you want to look. So when it comes to unexplained fatigue, it's sudden onset. Like all of a sudden, you're just getting tired, walking along, and all of a sudden, boom, you feel like you hit a wall. Or you have days where it's like you've gotten good sleep, you've eaten enough, all your activities are exactly the same as they've always been. Then all of a sudden, you're just tired all the time. Get that checked. Um, and the reason chronic fatigue is something that you want to get checked, or any fatigue you want to get checked, is because it can be anemia. And although we hear, oh, I'm anemic, anemia actually can affect your heart. So it's really important not to let it go on for too long. Depression, as I mentioned, untreated, unaddressed depression can actually worsen and become even psychosis. Um, Heart disease, especially congestive heart failure or having a mild heart attack, can actually cause fatigue. Arrhythmias like low heart rate or irregular heart rate, thyroid disorders are definitely something that causes fatigue. You hear this a lot. And the reason I hear a lot about this is because fatigue and weight often go hand in hand. So I hear a lot of this and I investigate a lot of it. And a lot of times they're also connected and I can find out the reason why. The problem we run into is that as women, especially, we are so used to being tired that we often dismiss our fatigue as being typical or what's considered normal in life. And so, and that's why it's just so important that if it changes, if it's suddenly you're kind of this low level fatigue you've always had, then all of a sudden it changes, it becomes more, then you get it checked. Number two is new changes in menstrual cycle. Obviously, this is more for women than men, but if you have a change in menstrual cycle, it could mean a couple of things. It could mean that either change like in irregularity, meaning that it comes on and goes off at different times. It lasts different times each and every time. The other is the flow may change. It suddenly gets drastically lower and it's not related to pregnancy, or it gets a lot heavier. The other is change in pain. If you never had menstrual cramps and all of a sudden you start having menstrual cramps, or you had menstrual cramps and those cramps start getting a lot worse, then usually we don't complain if they get better, but if they get worse, then that could be a mean that there's something else going on. So it's really important to get that checked, especially since um, polycystic ovary syndrome, which leads to insulin resistance, which then leads to weight gain, is part of this. Thyroid dysfunction, again, we see that again, tiredness, menstrual changes can be because of your thyroid. Um, Perimenopause. Now, perimenopause is a condition, not a disease. However, it is something that leads to, osteoporosis if you're going into menopause. It can lead to heart disease. It can lead to cholesterol issues. It can lead to dementia. It can lead to all these different things. So if you're going into menopause, early changes is when, hormone replacement therapy is the best time to start instead of waiting until your periods stop. The earlier you start HRT, the better when you're in a perimenopausal stage. And often what happens, the only indication is a change in the in the irregularity of a menstrual cycle. The other is when you're talking about pain, you always want to get increase in pain checked, mainly because endometriosis is one of the things, and that what that is that you have menstrual tissue outside of the uterus. It's not being contained where it's supposed to be, and so it can often cause severe pain. It can often cause severe complications, also infertility and lots of other things. Fibroids are another thing. Fibroids in and of themselves can cause severe anemia to the point of heart disease. It can also form and change into something cancerous. The middle part of fibroids can sometimes become cancerous. So, fibroids aren't that benign. They're benign in and of themselves, but if unaddressed, they may not stay benign. And so, changes in menstrual cycle may show this, especially the heaviness of the flow. Also, so change. That's number three is changes in gastrointestinal systems, or basically symptoms. Basically, what that means is that things that were going normally before suddenly start to change. Your appetite suddenly goes up or way down. Your bowel movements suddenly go up or go down. The color of your bowel movements change. You start noticing nausea, particularly after you eat. You start having chronic bloating. Bloating every once in a while is fine, but if you're bloating all the time, especially in women, this can be an indication of ovarian issues. And so that may be all you'll feel, or a fullness in your stomach, and you can't figure out why. Any changes in your GI symptoms they could be very mild, but when they are persistent, meaning that they just keep going, or they're always associated with food. Every time you eat, you get the symptom. It could be an intolerance. It could be an allergy, and which are not also can which let me slow down. It could be an intolerance or an allergy. Allergies in and of themselves can become dangerous. Foods that we are allergic to, we could be mildly allergic to them and then suddenly become severely allergic to them without warning. So if you notice that when you're eating certain foods, certain things happen, you start having a reaction, either skin reaction, nausea, bloating, anything that's related to GI tract, you always want to get that checked out because it can progress into something far worse. The other is if you have like really, really uh, smelly gas, if it's every once in a while, that's fine. However, if you haven't changed your eating habits and suddenly you start noticing that when you're passing gas, when you have flatulence, it's really foul. Get that checked. There could be something going on. It could be something as simple as, you know, having taken an antibiotic, so your GI flora is all messed up and all you need is a probiotic, or it could mean that there's something else going on, either some low level bleeding or something else. So you just want to ask your doctor about that. Um, especially, so of course we always want to worry about gastrointestinal cancers like colon cancer. You want to worry about gallstones, irritable bowel syndrome, and but the worst case, for women obviously is ovarian cancer. Often by the time you start feeling the symptoms, it's too late to do much about it. So you always want to get any type of, especially bloating, fullness that's just chronic and won't go away. You want to get that checked. Number 4 is shortness of breath. Now, we are very quick to say our shortness of breath comes from deconditioning. Now, this is something that is also very important to me because I was going into congestive heart failure after my daughter was born, and my shortness of breath was what made me seek attention. I started getting worse, and what I was told was that it was because I was very overweight. I was obese, morbidly obese. I had, 100 pounds heavier than I am now. I had just had a baby. I was anemic. I was also diabetic. And they were just like, well, of course, you're short of breath. Of course, you're tired. When in fact, it was my heart. And so it's really important that, if new onset shortness of breath, it's not something you've had before, or even if you've had mild shortness of breath and it suddenly starts getting worse, please get that checked. Don't let all shortness of breath be because, oh, I'm tired, oh, I'm just out of shape, oh, I'm whatever. It's not. If it's always been there, that's one thing. But if it's something new, that can't be it. It has to be something else. And so you just want to get that checked, especially with women. Now, one of the symptoms that we have with a heart attack is often just shortness of breath. That's it. We may not notice anything else. So, because our lungs and our heart are connected. And so when we have shortness of breath, it's always very important to get it checked. New onset asthma, which comes on with new onset allergies, which can happen as adults. So again, shortness of breath is not something to ignore. The 5th is unexplained weight gain or weight loss. Now, this is where I come in. This is where I see people. This is what I check for. This is why I treat weight gain and weight loss so incredibly seriously. This is not about cosmetics. It's not about looking cute. It's not about trying to fit into somebody's clothes. Even if someone comes to me because that's the reason they want to lose weight, that is absolutely fine. And that is your right. I have no problem with that. But it's my job to find out why. Because that why may not be as simple as, oh, you're eating too much, which most of us don't when we gain weight. Or it's because you're not exercising. Well, if you never exercised, why are you all of a sudden gaining weight from not exercising? Can't be that. Sometimes it's because of menopause. That can happen. But again, there's a reason it gained. It's not just, oh, it magically happens. There's an underlying metabolic reason that people gain weight during menopause. There's always an underlying reason why people gain or lose weight. And it's my job to find out what those reasons are. And there's always a reason. And that reason is rarely behavioral. And I'm going to say that again. Weight gain, especially, even with weight loss, there's always an underlying reason, and the reason is rarely behavioral. Now, it's more likely to be behavioral if it's weight loss, but less so if it's weight gain, unless you all of a sudden start eating differently, you start moving differently, or you change some lifestyle thing. But if everything remains the same and you start gaining weight, there's a biological reason that has to be investigated. And that's why I do what I do. Um, and so for those of you who are making comments, I will circle back and we'll talk about those. So ignoring symptoms delays diagnosis. It delays treatment. And that's where the problem lies. Things that are caught early can often be reversed, can often be stopped, can often be uh, um, completely cured. However, it's when things are left for too long, and especially if we allow them to go so long that they worsen and worsen and worsen, and then it gets to the point where it's unbearable, and then we seek help, often it's too late. So again, I'm just going to read through the 5 things again that I did for women, and then we're going to talk a little bit about some of the things that are unique to men and some that are the same for both. So number 1, unexplained fatigue, tiredness that doesn't have a reason. Nothing else has changed and you're all of a sudden getting tired. Number 2, new changes in menstrual cycle, irregularity, pain, flow changes up or down, especially down, not related to pregnancy or anything else, then those are all reasons that you should get things checked, even if you know it's menopause, because menopause can be treated, because untreated menopause causes secondary other things like bone loss, like dementia, like heart disease. So, just saying, oh, it's menopause and that means it's benign, that's not the case. There are a lot of things that treating menopause will do that helps protect you later in life. Number 3 is a change in the gastrointestinal system symptoms, like GI symptoms. Basically, bloating, chronic, all the time bloating is something that should be checked out. It is one of the symptoms of ovarian cancer, and often with ovarian cancer, if you wait until you have pain, it's too late. Changes in nausea, changes in your body's reaction to food when you eat are all things that need to be checked. So again, number 1, I'm going through this again. I'm supposed to be listing and I'm going through the explanations again because I'm seeing new people joining. So number 1, unexplained fatigue. Number 2 is changes in menstrual cycle. Number 3 is gastrointestinal symptoms. Number 4 is shortness of breath. That's new onset and not related, and just something that's not happened before. And number 5 is a change in your weight, going up or going down. Now, with both men and women, changes in urinary habits are another thing that should not be ignored. No change in how much you're drinking, no change in how much you're eating, and all of a sudden you start going to the bathroom a lot. You start urinating all the time. That can be an indication of diabetes. It can be an indication that you have an infection. It could be an indication of other things. And infection, bladder infections, urinary tract infections, again, can become very, very dangerous. They are deadly if left untreated. You can die from a UTI. And I'm not being melodramatic about that. When you have a UTI, what happens is you have bacteria in your bladder. If it goes untreated, that bacteria goes up to your kidneys. When your kidneys get infected, suddenly all the things that need to be purified from your kidneys stops. And the bacteria then can get into your bloodstream and you end up with what's called urosepsis. Urosepsis is deadly, especially if it's with a strain of bacteria that there's no antibiotic that can fight it. So don't take UTIs lightly. They're not something just to be ignored. And it's not something just to be treated over the counter. It's something you should go to your doctor for and make sure you have the right antibiotic to treat what UTI you have. The other thing for men, though, when they have urinary changes, it could be, yes, diabetes, just like for women, but they also could have some prostate issues going on. And that's why it's important that if you start having changes in urinary stream, in your ability to start urinating, in your ability to stop urinating, there's always something going on that needs to be checked. It could just be nothing that you can do anything about, but at least you want to make sure it's not something dangerous. But the other for men, that is not the case for women. Although women may have a change in libido, they may have a change in the ability to have orgasms, they may have painful intercourse depending on where you are in the menopausal cycle. But for men, erectile dysfunction, it can be an indication of something else going on. Now, I did say mild symptoms. Men may not consider that mild. However, um, when I say mild, and when it comes to erectile dysfunction, it's not painful. But if having difficulty either uh, having erections or maintaining erections could be an indication of heart disease or diabetes or something else going on. So it's always something important to get checked. And it's not just something you order something over, on the internet to take care of. It needs to be worked up because it could be connected to another organ, a more serious organ in your body. Um, and so, these are things that we often experience all the time. And many times, when we go to the doctor, it's really hard because, the way insurance is done, we're only given time and the resources to address one thing at a time. Insurance companies have dictated that we're only allowed to take care of one or two things during each doctor visit. And the doctor visits are getting shorter and shorter because they're paying doctors less and less for each of those visits. So in order to keep your lights on, you've just got to see more patients, which is why so many of us have stopped taking insurance. So we're not beholden to them. But so what's really important if you're having these type of symptoms, either don't ignore them and make a second appointment, or um, make it the primary of your appointment if there's nothing else going on that you need to discuss. And so if you have questions, Cynthia Jackson says, my daughter's stomach is too big. What does she need to do? Well, it depends on the reason why it's big. Is it big because of something on the outside? Is it fat? Is it big because there's something underneath, like a tumor? Is it big because there's lots of different reasons. The main thing she needs to do then is go to her doctor and find out why. Get worked up as to why that is the case. Denise says, I believe mine is menopause. When you say mine, my what? Denise says, thanks for information. Yes. Janine also said, yes, can cause sepsis. Good evening from Lawrenceville, Georgia. Hello, Patsy. Thank you for joining in. Yes, you did know that. I'm assuming you're talking about the urosepsis. Yeah. It's sad that insurance companies are regulating our medical appointments. Yes, and they have, and it's getting worse and worse and worse, which is why you're finding so many doctors are stop taking insurance because it became too hard to practice good medicine. And not only that, it's like they tell you what medicines you can prescribe, they tell you what tests you can get, they tell you how, what referrals should be, are appropriate. And it just gets to the point where it's like you cannot treat. I've been in medicine 30 years. It's gotten to the point where it's hard to treat medicine in the way that I was trained, which is to treat the person and their symptoms and not their numbers. But insurance companies dictate that we have to have numbers to back up why we believe something is the case. And unfortunately, when it comes to certain things, by the time the numbers show it, it's too late. Oh, so Janine just said, yeah, your weight gain could be menopause. Now understand this. Menopausal weight gain is not inevitable. There's a reason for it, and it's a metabolic reason. It's not just, oh, my metabolism slows down and all of a sudden I'm starting to gain weight. It's because your estrogen drops, your cortisol becomes unopposed, and that cortisol causes insulin resistance, which throws off your cholesterol, which throws off your blood sugars, which means that your brain is being affected, your kidneys are being affected, your heart and small vessels are being affected. So menopause is not benign. It should be treated, especially if you're symptomatic. Weight gain is a symptom that states that there's something metabolic going on and it should be addressed. Now, there are ways of doing that without medication if you don't want to take it, and that is through muscle, building muscle. Muscle is the only metabolic organ we have in our bodies. I mean, obviously, you have the other organs that contribute, but muscle is the only thing that can counter any metabolic derangement. Thyroid can affect it, but that's easily corrected with hormone therapy. Um, I'm just going through. You said doctor said no tumor. Well, that's good. Um, Hello from Wisconsin, Midwest. I'm from Michigan originally. Um, so Marie Lucas says, my daughter has constant dizziness and is feeling weak. Doctors can't find anything wrong with her. Um, there's probably, so the key is when you have symptoms like dizziness and feeling weak, is to stick with the person who's doing the investigation. The way medicine is set up, and especially with insurance, we're told we have to take certain steps. Step 1, step 2, step 3. Before we can take step 2, we have to do step 1. Before we can do step 3, we've got to do step 2, and so on and so on. When you switch doctors in the middle of a process, you go back to square one. Unless it's a referral from one doctor to another, the progress halts and often gets reversed. So it's really important because time also matters. So it's really important to try and stick with the same doctor who's doing the investigation and give it time, because the way medicine is like a puzzle. It's like anyone who's done puzzle, there are pieces, you're looking and you're trying to see where it fits. And when it doesn't fit in one place, you look in another place and see if it fits there. And if it doesn't fit there, you try another. And it's just like it being in a maze. You go down one, you might hit a roadblock. So you turn around and you go another way and see if that way works. That's how medicine is when it's investigating something that we don't know what it is. So sticking with the process, sticking with the same doctor actually gets the answer a whole lot faster than jumping around to different ones. You say, how do I know if I'm insulin resistant? Well, insulin resistance is usually found with a glucose tolerance test and an insulin test during the glucose tolerance test. Now, it has to be ordered absolutely correctly and it has to be drawn absolutely correctly. And what this means is you get your blood sugar, A1C, and insulin levels are checked. You then are given a glucose challenge, something very sweet to drink. And then an hour later, you check the blood sugar and insulin levels again. That's how you find it. And usually what it shows is the blood sugars go up very high. And even if the blood sugars don't go up very high, your insulin levels go up very high. The other way you can tell if you're insulin resistant, if you're not diabetic already, if your A1C is low, normal or low, is you end up with the ring around the base of your neck. Now, actually, you can see it on me because I have diabetes. So you see my metabolic ring. And what that is, it's a ring you get around the base of your neck when you have metabolic issues. It's one of the most obvious and most common things you see in insulin resistance in people who are not already diagnosed with pre-diabetes or diabetes. So if you're gaining weight or you're already overweight or you have obesity and you have this dark ring around your neck, I can bet you not even a bet, you absolutely have some type of metabolic syndrome, and that metabolic syndrome is probably insulin resistance. So that's how you know. So just so you know, I do have a Facebook group that you can join and ask me these questions again if you want, because I do answer questions there, and it's facebook.com. Actually, I'll just write it into the comments. So what this is, I put in I'm just checking the spelling to make sure everything. Okay. So what this is my Facebook group. You can join and ask me questions there. I do a lot of educating, and so as the time goes on, the other is you can subscribe to my YouTube channel, which is basically at Dr. Tumor, and you can check my YouTube channel and see if there's an answer in one of the videos I've done. I think I'm up to 120 videos, so there's ways that you can find information there as well. And I do respond to comments in both places. So if you post a comment on my YouTube channel or in my Facebook group, I will respond. Says, what does it mean when you take glucose tolerance test and your numbers drop after you drink instead of increasing after an hour? Okay. When you say numbers, what numbers? Because it depends on which numbers you're talking about. If it's blood sugar that drops, that's insulin resistance also. 'Cause what that means is your insulin levels have shot up so high that they've dropped your blood sugar super low. It's called insulin reaction. So if you're done a glucose tolerance test and your insulin level was not checked, the only way you'd know that you have insulin resistance is if your blood sugar bottoms out. That's it, because it only happens in insulin resistance. My oncologist is associating this with damaged nerve. Now, just so you know, as I'm talking, if you say this, I don't know which this you're referring to. So I'm not sure, Shanika. Thank you for the comment, but I don't know what this you're referring to. It says my oncologist is associating this with damaged nerve. So I'm assuming that means some type of. I'm not sure what this is. Oh, Janine's glucose. Okay. Again, when you say this, I don't know what this you're talking about. It says, I've been experiencing this after completing chemotherapy and radiation. I'm not sure what this is. So, leg pain. Okay. So you've been experiencing leg pain after. Yeah. I mean, the problem with nerves is that nerves are highly sensitive. Nerves are sensitive to radiation. Nerves are sensitive to chemicals. Nerves are sensitive to medication. Nerves are sensitive to blood sugar. Nerves are sensitive to circulation. It's the reason we get pins and needles, like the tingling feeling when our circulation's cut off. So yeah, nerves are everywhere in the body, and the bigger nerves, when irritated, cause more of a problem, but the smaller ones do too. And Unique, I hope that I'm not sure how long you've been on chemotherapy and radiation, but I do really hope it's working for you. And I know it's a scary time. There's never not a scary time when being treated for cancer of any type. So I just know that, we recognize that. Is there a way to know if I'm having insulin resistance? Mark, I just mentioned that. So this is what I'd like you to do. So earlier I put in my group for Facebook. If you're join my Facebook group and ask questions there for a couple reasons. One, I answer them once and everybody gets to see it. The other is it's something that you can also take with you. Once this shuts down, you lose the answer. And again, insulin resistance is done through glucose tolerance tests and insulin levels with a glucose tolerance test, but also depending on who you are, if you get a dark ring around the base of your neck, and this is what's called a metabolic ring. I have it because I'm diabetic, so I am on the other end of the continuum. Insulin resistance is on this end, diabetes is on the other end, and I'm already up here. So I've been diabetic now for 26 years. And so are there any other questions? Any other comments? Okay. So like I said, if you join my Facebook group, you can ask me questions there. You can ask me questions on YouTube. I do see them and I do answer them. I have that ring. Okay. If you have that ring, talk to your doctor about getting checked for diabetes or get a glucose. If you don't have diabetes already, which is a hemoglobin A1C, if it's anything up to 5.6, it's considered normal, but you can be insulin resistant even if it's in the 4s. And if it's between 5.7 and 6.4, that means you are pre-diabetic. And if you are over 6.5 or above, that means you are diabetic. All of those are treatable. They're all treatable in the same way, either with a low carbohydrate, high protein diet, muscle work, stress reduction, and medication if necessary. Yes, insulin resistance can be detected by blood test. Again, glucose tolerance test, a 1-hour glucose tolerance test with a free insulin level checked at the 1-hour mark. So I am going to write my Facebook page again. It is facebook.com/groups/total weight loss. And that's the group. And then also, like I said, you can also subscribe to my YouTube channel and ask me questions there. Okay. Any other questions? Any other comments? All right. Well, thank you for joining. I appreciate it. And okay, let me see here. Delete comment. And people are starting to all right. Well, if there are no more questions and no more comments, I will be here again next week, every Tuesday. Oh, my YouTube channel is youtube.com/at Dr. Tumor. So I'll just write it. youtube.com/at. That's my YouTube channel. Okay. So if there are no more questions and no more comments, I will say good night. And I will see you next Tuesday at 6 p.m. Eastern, right here, live for the Dr. Tumor Talk Show. Thank you. Thank you so much for joining. I really do appreciate it.